Next on the program, we're going to shift gears a little bit and move to a real expert in this patient-focused drug development process. James Valentine is an attorney who also received a master's degree in health policy from Johns Hopkins Bloomberg School of Public Health. And he worked for the FDA for a number of years and developed this patient-focused drug development program. Now he's an attorney here in Washington who helps clients address issues related to drug development and patient advocacy. And James is here because he is the absolute expert in running these patient-focused drug development meetings. And so he's going to be at the controls from here on. James, thank you very much.
Thank you for that kind introduction, and it's really my pleasure to be here this morning to help moderate this externally led patient-focused drug development meeting on pancreatitis. As you heard from Dr. Lyons, this meeting is really a way for us to systematically hear from and learn from all of you, patients and individuals that are caring for patients with pancreatitis. This is so key to be able to inform not only FDA's understanding, but really the entire drug development ecosystem, so that way decisions can be made that are anchored to what is really most important to you based off of your experiences and your preferences for future treatments. I can say that this is a really unique opportunity for your community with many thousands of known conditions that exist. You heard from Dr. Lyons that there's been over 25 FDA-led PFDD meetings, and today marks, at least by my count, the 32nd externally led PFDD meeting. So quite a unique opportunity to be able to convene and have all the stakeholders here in the room to hear from you directly. So what will we be discussing today? You can see in the meeting programs that you have an agenda laid out. I'm going to talk through that very briefly. As you can see, the meeting is structured in a way that we're going to first this morning talk about the adult experience with pancreatitis, and then we're going to come back after a quick break and dig a little bit into the pediatric experience in pancreatitis. Within each of those two topic sessions that we have, there's a number of issues that we want to explore with you. We're going to first be posing questions and getting your inputs on your experiences with the symptoms, health effects, and impacts on daily life that you experience as a result of your pancreatitis itself. We'll be asking you not just what are those symptoms and health effects, but really ask you to help us understand which have the greatest burden and impact on your daily life. And related to that, help us understand which activities that are important to you are you not able to do either at all or as fully as you might want because of those symptoms and health effects. We'll also be asking you to help us understand the disease in day-to-day life. How much does it vary, say, from day to day, week to week, month to month, or over the course of progression of the disease, as well as maybe, what a best day versus a worst day might look like. And then, of course, knowing that not all of the disease is experienced at present day, knowing that progression may occur, we'd like to hear about your worries for the future of living with pancreatitis. We'll then build on that and have some questions for you related to your treatment experience. So we're going to want to understand what different approaches you take to treating and managing your condition. This is, when I say treatments, I mean that in a very broad sense. So we're going to be asking not only about prescription drugs, but things and medical procedures, but things that you might employ in your daily life, whether that be diet, exercise, even lifestyle modifications. Really think about that holistically and helping us understand what it is you utilize. And then once we've got a sense of that, help us understand how well that's working, as well as what are the downsides or trade-offs that you experience as a result of those treatments. And then finally, we're going to look towards the future, and we're going to ask you to tell us about what it is you'd like to see from a future treatment. Of course, everybody in this room today would agree that we'd want a cure for pancreatitis, but short of that, from that next therapy that might be coming down the pipeline, what is it that would specifically provide a benefit to you in your daily life? So we'll explore that a little bit. So how are we going to draw all of that out? It's a hefty set of issues to explore. Well, we have 3 methods that are kind of built into each of those 2 sessions we'll have. We're going to kick it off by first hearing from a panel of patients and caregivers. This is going to set a good foundation for the discussion that we'll have here in the room that will follow. The panelists were selected to reflect a range of experiences. Of course, they can't be fully representative. You can never have 4 people that fully represent a community, but will at least help get us kicked off and set the stage. We'll then broaden the discussion with a combination of polling questions. So those in the room will be able to use their cell phones, or if you have a laptop or tablet, you certainly can use that. And for those of you following along on the webcast, you'll be able to pull up a browser and answer those same questions for us. We'll get to see the results live, and those questions will give us a sense of who we have participating here in the room and on the web, and will give us then a launching point into an audience discussion that I'll facilitate with those of you here in the room, asking you many of those questions that I just previewed. During that period, I'll ask for questions. I'll ask you to just raise your hand. I'll call on you, and if you state your name, we'll be able to have you add to the conversation here in the room. I want to say that today is not the only opportunity to provide your input, although we very much encourage you to share today. But if you leave the meeting today and feel that you just have something burning that you need to provide that to be considered for that voice of the patient summary report that will be developed, or if you're on the web and you're not able to participate in the discussion here in the room, or maybe you're watching this recording or you weren't able to attend the meeting today and you want to provide your thoughts, we will be sending out a link to all of the registrants with a kind of web form to be able to provide additional written comments, which, like all of the input today, will be considered in drafting that summary report, that voice of the patient report, that will both be submitted to FDA as well as be available to those that are doing research and development. So one final thing before we get into our first round of polling questions, which are some demographic polling questions, just want to cover a few ground rules. One, we are having this meeting because we want and need to hear from you, individuals with pancreatitis and their caregivers, family members, to be able to contribute to this dialogue. That being said, the different interactions that we'll be having today are limited to patients and their direct caregivers, family members. FDA, drug developers, and our clinician partners are here to listen. I also want to mention that the views today are inherently personal. You're sharing your personal experiences, and at times may get emotional. And so because of that, respect for one another is paramount. So to that end, I just ask that when you are providing your comments today, to please try to be focused and concise, so that way we can try to hear as many voices as possible in the time that we do have allotted. So with that, let's go ahead and jump into our first set of polling questions. So for those of you in the room, please pull out your cell phones. Again, this is for caregivers and patients only. And for those of you on the web, please go ahead and open up a browser. And you can go to the URL pollev.com/pancreas. It's right here at the top of the slide that you're seeing right now. So these questions, we would like for caregivers to answer these for the patients that they're responding. So for this question, where do you currently reside? Please respond in terms of where the patient resides. It very well may be that you live in the same place. It might be expected. But just from here and throughout, answer on behalf of the patient. So go ahead and answer this first question, where do you currently reside? These are your response options. If you're having any difficulty in the room accessing this polling, please raise your hand and we'll make sure to send someone to you to help you get in. Any issues accessing? Oh, we have one hand right here. Someone, Larry, maybe help out right here. All right. So it looks like everybody's into, oh, one more right here, Larry. We just want to make sure we get everybody into the system so that way we can follow all of your responses forward throughout the meeting. So while we're getting that final responses in, just to report out on who we have represented today. Perhaps not surprisingly, because of the time that we're starting and the location of the meeting itself, a little over half of our participants represented reside in U.S. Eastern Time Zone. We have about a third of individuals from the Central Time Zone and just over 5% in the Pacific Time Zone. We do have representation from outside of North America, including some from the EU, Middle East, and Asia. We can go to the next question. So our second question is, what is the gender of the individual you're representing today? So if you're a patient, answer on behalf of yourself. If you're a caregiver, this is the gender of the individual that you care for with pancreatitis. Options are A, male, or B, female. Just give you a few moments. Well, while final results are trickling in, it looks like the pattern here is clear. About 3/4 of our participants are representing a patient, female patient, and about 1/4 of our participants are representing a male patient. And it looks like the gap between that is growing a little bit as more responses trickle in. Next question. So this question is, how old are you? Again, we're talking about the patient. Is the patient younger than 18 years of age? B, between 18 and 30 years? C, between 31 and 50 years? D, between 51 and 60 years? Or E, greater than 60 years of age? So while any final results are trickling in, it looks like our greatest group represented is the 31 to 50 year age group. However, we do have good representation across the different age ranges, with the next largest group being those over age 60, and the smallest group being those aged 51 to 60. Next question. So here, we'd like to know, at which age did you or the patient you care for first have their first symptoms of pancreatitis? And your options here are A, age 5 or earlier, B, between ages 6 and 18, C, between ages 19 and 30, D, between ages 31 and 50, E, between ages 51 and 60, or F, older than 60 years of age at time of first symptoms. So it looks like the age at which the most of the individuals we have represented today had their first symptoms of pancreatitis, with about 40% between the ages of 31 and 50. However, we do have quite a bit of representation of those that had their first symptoms during childhood, whether that be age 0 to 5 or 6 to 18. And then we also have a number of individuals, just about 10% each, that had their first symptoms between ages 19 and 30 or between 51 and 60. And no one present today had their first symptoms older than age 60, or someone, I think that's probably one person, just chimed in saying that they had that experience. Next question. So here we'd like you to answer what type of pancreatitis that you or your loved one have. Is it A, acute pancreatitis, B, recurrent acute pancreatitis, C, chronic pancreatitis, D, hereditary, E, acute hemorrhagic, F, pancreas divisum, G, autoimmune, or H, related to some other disease? Please select the category that best applies to you or your loved one. Well, final results are trickling in. It looks like just about half of our audience reports having chronic pancreatitis. We have about a fifth with hereditary, and then we do have representation from recurrent acute, pancreas divisum, less so, but also representation from autoimmune and acute, as well as related to another disease. It looks like no one has reported acute hemorrhagic. Next question. So now to just get a little bit more of a sense of your experience with pancreatitis, we want to know how many times have you been admitted to the hospital for your pancreatitis? So have you never been admitted to the hospital for your pancreatitis for option A? B, have you been admitted 1 to 5 times? C, 6 to 10 times? Or D, more than 10 times? So it looks like just about half of you have been admitted to the hospital for your pancreatitis more than 10 times. I'm sure this will come out, understanding the cause of those admissions as we dive into your experiences. And then we have good representation from those that have been admitted between 1 to 5 or 6 to 10, and just a few people have never been admitted to the hospital for their pancreatitis. And can we go to our final demographic polling question? So here again, to get another sense of your experience with your pancreatitis, how many endoscopic or surgical procedures have you had to treat your pancreatitis? Same options as before: A, none; B, 1 to 5; C, 6 to 10; or D, more than 10 endoscopic or surgical procedures. During the discussion, we're certainly going to want to hear what procedures that you have had, how many of the different types, and what impact that has had, both good and bad, on your experience. So it's looking like about half of you have had between 1 and 5 procedures. Another close to half have had more than that. And then again, a few people have had no procedures. All right. Well, thank you for participating in those polling questions. It's great to have a sense of some of who we have in the room and some of your experience, and we're certainly going to be building on that quite a bit as we move on.